Public.
Oh, snap.
Oh,
snap.
The public food assistance.
Public
yes,
food
I have heard
assistance
of that.
SNAP. So you've heard of this, right?
Yep.
And right now, people get food stamps or whatever, and they can go buy pretty much anything in any store.
Right now, I think the only two things you cannot buy it's alcohol and cigarettes
Okay.
in a supermarket. However, you can buy a lot of other deadlier things in the supermarket that you're feeding your things, and all that is subsidized by the government. So the government that's having a conversation about chronic disease and Medicaid costs because of all this chronic illness, they're not taking consideration that they're actually the ones creating the problem in the beginning by feeding these people the bad food that's in the market.
Well, incentivizing it by making it cheaper.
And which is even worse.
Because you get however much you get a month. If you say, well, I can get 10 bags of food for this much, or I can get 1 bag of food for this much, what are you going to do?
I read, I think it was social media. I read somebody brought a great idea. It's like, why don't you take the people that have the SNAP program, right? And you create a warehouse just like a Costco, but it's cheaper, it's subsidized, it's cheaper, but it's Whole Foods. You can go in there only just to buy these things. That'd be nice.
So I heard that they're changing the program or talking about changing the program. Can you tell me a little bit
They're
about
working
that?
with the FDA right now.
Okay.
They're working with the FDA to make sure that there's certain foods that people should not get in the program that are not healthy. They're not healthy right now.
Do you know what types of food those might be? Because to be honest, it's probably 80% of the grocery store right now. So like, what are you gonna do?
That's the problem.
That's the
actually,
problem.
I mean, that is the problem is that the program is designed to help families afford the food they need to give themselves and their children proper nutrition. And if they're able to then instead purchase Oreo cookies, some Lunchables, and these are all things riddled in preservatives, dyes, chemicals that you can't even pronounce on the back. Now we're making the kids sick. We're throwing sugar at them, which is just increasing.
And now they're
going
gonna
to
need to use their
Medicaid
Medicaid.
like crazy. They don't have necessarily, the healthcare options that families that are in a different tax bracket do. So they just, it tends to be a downhill
It's a cycle.
spiral, and they don't even realize it, unfortunately, because one, they trust the government is protecting. They trust the government is making sure that the things they're eating are safe. And it's only now recently that we're realizing that's not the case.
And it's almost like the government's enabling the
are
cycle of
enabling.
sickness and the cycle of destruction, really.
Yep. So here's what they're trying to do. So SNAP recipients will not be able to use benefits to buy energy drinks, which we talked about them before. They're not good for your body. Sweetened beverages with added sugars or sweeteners.
So soda.
Soda, yeah. Carbonated beverage, candy, potato or corn chips, or cookies. So pretty much all the ultra-processed foods.
But you could still buy a lot of stuff in the freezer section and stuff
You
like
cannot buy, right now with the program right now, the 3 things you cannot buy, it's alcohol, tobacco, and prepared meals. So I don't know.
Prepared meals?
Yeah.
Really?
You cannot buy them.
That's actually brilliant.
Yeah.
Sorry.
So that's actually pretty good. So that's a good start. So the program is not that bad. It could become better, which is the best part. And that's the cool thing about the government. It's so bad that even little tweaks in it can make a big difference in our population.
No, it's interesting because this is like I tell a lot of patients when I'm talking to them, this is one of the few times or one of the only times in a very long time where the parents are living longer than the kids because the parents grew up in households that cooked proper foods. They sat down to a table where they had vegetables, they had proteins. They didn't eat the crap that we're having now. And the kids that they have been grown up chicken nuggets, pizza, burgers and fries, mac and cheese, just crap for years of their life. And now they're getting the illnesses that we didn't see until someone was 40, 50, 60, and they have it at 18, 19, 20. When you see, you go to a classroom and most of the kids in the classroom are well overweight.
Bro, that's not normal.
It's not normal. Especially that kids are the most active,
Well, they're
really
supposed to
more
be.
active than we are as adults. But unfortunately, now they're becoming sedentary. They're being fed, and enabled by their parents, and then their parents by the government, sugars and foods that are just not great for us. And it's just a downward spiral. And it's a shame because, like I said, it affects lower income families more all the way down, because then they don't even have the health care to defend their bodies.
Yeah, check this out. So according to the USDA, 20% of SNAP households, most of the households spending on sweetened beverages, desserts, salty snacks, and candy. So 20% of the expenditure is on these crappy things, and sweetened beverages alone accounted for 9.3% of the expenditure.
And you know what's crazy is I could hear people saying, hey, they might not have time because it might be a single mom who's trying to work too. They might not have time to cook.
I can't.
Single moms have been around for a very long time.
Yeah, this is not a new thing.
Listen to this, though. So people's excuse is, hey, I don't have time to cook, right? Hannah says, you're busy, right?
I hate that.
How easy is it to learn a couple of recipes that aren't very long to make, like you can prepare very quickly, that are nutritious?
It's not hard.
I mean, salad doesn't take that long to make.
It's not that hard.
It's not that hard.
The same effort that you put in to binge watch the Kardashians, and the same effort that you put on to
Watch Formula One.
And to be honest, that's what the rush is. They don't have time to cook because they're trying to rush to the couch. You know what I mean? Like,
I like
most
that.
of America,
That's
this
a
is
good
where we are.
tagline.
I've been working hard, sitting at my desk. I need to sit on the couch to watch TV for a few hours. Kids go throw the pizza in the oven. They won't even get up to do it. You go do it.
Yeah.
But it's a shame.
You go do it.
2 vegetables. You pick carrots, green beans, potatoes. These are easy things to cook. You stick it in an oven. You know, you don't even salt and pepper.
You can put an entire potato in an oven.
Boil it.
Right.
Yeah.
You know what I mean?
You have nephews. I have a nephew. You have your son. I'm sure your son, if let's say you guys are stepping out, gonna grab, I don't know, the mail, and it's far, you're gonna help someone, a neighbor, and you're gonna be out for 15, 20 minutes, and he's hungry. Can he go to the?
He can figure out.
He can figure out and do something for him.
Mm-hmm.
Why is a mom? I mean, you are big enough, young lady or old lady, to have a child, and you're gonna tell me that you don't know how to cook like a normal. I'm not saying like go out and chef out. You know, I'm just saying a dignity like warm plate that you can put in front of your child. You cannot do that. Like, that's an excuse to me. I'm sorry. I'm so tired. We get home late, and you still need to find a way priorities, you know?
Well, and here's the thing. The reason my son can do that at 11, 10, and other kids is because we have good ingredients in our house. Mm-hmm. And I have things prepared for him that he can put in a toaster oven. Mm-hmm. And he can make. I make up egg casserole that he can just heat up. And guess what's in it? Egg, cheese, organic beef sausage. Like... Oh, and some shredded organic potatoes. I'm sorry. Like you can put it in the. It can put it in the.
But that's with your parents. I come from my mom being done at work at 5:30, and then they wouldn't pick me up from school until 6:30. I went to a private school, so they will wait for you until your parents get there. So we would get home late, and it's like you. There was something already made from yesterday, or there was something defrosting in the fridge, and it's like, I'm gonna cook something for you. There was always, like, I learned that from my mom, and I'm very thankful. Like, I never had to go to a fast food. I mean, I'm not saying that it was like, wow, like, mom, but there was always something warm. Not that cheap crap that you go to the how do you call it, alacena in English?
Pantry.
To the pantry and grab a potato chips and a hot dog. And, I mean, it's just priorities.
Yeah. And even with the SNAP program and the obesity rates, considering, let's assume that people can't cook. Right, and let's assume they cannot figure out how to cook for themselves. Even if you removed Coke products or Pepsi products out of the equation, that's a huge win.
I think we can start there. That's the easiest way.
Yeah,
that was like the second thing we got rid of.
Remove the crap from your pantry.
That's a small start, but listen, we are decades away from where the 50s, 60s, 70s when people were cooking. We have this, and I don't care what your tax bracket is or where your income level is. You somehow have a phone because the government will also supply them. Yeah. And from this phone, I can find any recipe that I need.
And a YouTube video on how to prepare it.
Whether it's a YouTube video,
TikTok.
It's a website, I can look specific. AI, jump on, tell me a recipe for blah, blah. And you can find a recipe and omit any of the things that you don't want in it. Give me a recipe that does not have sugar, that's all healthy, natural, 2 vegetables. boom, and then have it create your shopping list. So that's not an excuse.
But it comes back to what you said, which is like you have to have the right things in your house, right?
Yeah.
So stop buying the pop, stop buying the soda, stop buying the chips. Like, but if you buy potatoes and strawberries and apples and oranges and lettuce and whatever.
Ideally you have freedom of choice. If you want to buy the crap, go for it. If you want to kill yourself, let's do it. Okay. However, if I'm subsidizing, I'm paying as a taxpayer for you to buy Coke products, and then I got to subsidize also your sickness because you spent all your life buying the Coke products that I paid for initially. Now we got a big issue.
Yeah.
True story.
Right?
You're gonna kill yourself with some.
But don't drag me down with you.
So don't drag me down with you. I try to do healthy as much as I can. I'm trying to keep my costs low so I don't have to spend a lot of insurance. But if I'm also paying for Medicaid all the time, so you can make whatever choices you want, just like people.
And then you have less money to buy the healthy food.
Well, and you know what? And I really, fresh vegetables are cheap.
I don't know where that concept of healthy food is expensive.
It's not all.
No, the cooking process is pre-done and shoved in a box with all the chemicals. That's where it gets expensive. But if you're just picking up the carrots, you're just
Especially
picking up and even if you can hit one of your local farmers markets, I know we don't all have them, but 2 vegetables and a protein. There's your meal. It doesn't need to be
Especially if you
fabulous.
shop in season. Like
You absolutely should to keep diversity
But
in your
even the
diet.
meat too, Doc, because I mean, think about like a chuck, like a
ground beef
or chuck,
Ground beef or chuck
ground beef
roast.
or the
Chuck
chuck
roast.
roast.
Yeah.
If you have a big family too, you have a crock pot. I learned that that's not a thing in Puerto Rico. You don't have crock pot. I learned that in the United States.
We don't use that thing.
We
down
don't
there.
use that. It's
We don't
funny.
use
I have
that
a
thing.
ceramic one.
We don't use that thing.
Yeah,
We don't
I have a
use
ceramic one
dishwashers.
too, but you can make that, and then that lasts for days.
That's
For
bougie.
sure.
And-
you can do
and
it while
it's
you're
cheap.
at work. You put everything in the
I
pot,
got
you walk
I got one
away.
of them in the crock pot right now.
Yeah, there you go.
No, I mean, it's ideal.
She used to have a friend. Can you tell a story about the crock pot?
I have a funny. Okay, so how I was introduced to the crock pot. This was like 4 years in of being in the United States. I had my
2014.
first roommate, 2014, and then fresh out of college, my friend, she's from Florida, and I thought it was a southern thing, but she had this huge thing where she would put meat in the morning with vegetables, potatoes, and then she would leave to work, and I would like start getting ready in the morning, and I'm like, this crazy lady, and her name is Lindsay. She's probably gonna listen, but it's like, she's gonna try to burn the house. I will turn it off without saying anything. I will turn it off and we'll go to work. She will come in the morning. It's one of those electric too. So once the timer is done, it will go back to off. So she thought, what is up? So she comes the first night and she's like, dang it, like this didn't cook. This terrible. You know when you're thinking the whole day, this is
Yeah,
gonna
you
be
walk
ready.
home and it's gonna be
Exactly.
ready.
So second day, same thing. She turns it on and I'm like, I walk to the thing and I'm like, oh my God, what is wrong with her? She left this on, so I turn it off again. So
Because you waste the meat too because it's sitting
she-
out all day.
she comes back and she's like, "What the hell?" And I hear her, so I walk out and I'm like, "What's going on, Lindsay? Do you know why this is off?" And I'm like, "I turned it off. You're trying to burn the house." She's like, "Girl, this is a crock pot." I'm like, "What is a crock pot?" Dinner. You're trying to burn the house. She's like, "No, you're not gonna burn it." And then that's how I learned what a crock pot is.
When you actually ate a crock pot meal for the first time, you're like,
Friggin'.
this is delicious.
So she made me buy a crock pot.
She made you buy a crock pot.
I now have a crock pot. Thank you, Lindsay.
There are wonderful things you can do in the crock
But
pot.
but going back to the conversation, I mean, you can do healthy things. It doesn't cost that much money at the end of the day. And going back to the SNAP program, they should get rid of soda. They should get rid of candy. They should get rid of Oreos. Anything that's ultra processed that comes in a bag that doesn't have any real nutritional value, get rid of it. And just focus, put your funds towards, because again, you're probably gonna spend a little bit more money in the SNAP program to give them healthier food initially, but then you'll save costs down the road from healthcare in general.
And healthy food makes you do better, right?
Well, and I'm positive. I'm hopeful with this because, I mean, when there was no regulation, we knew, these things are bad for us, sugars and processed foods and preservatives, and yet people are still out there and they're buying them for their kids. So in this particular situation, I'm kind of for it because if we take that away, they have no choice but to get the more healthy options, the foods that are available in the program, and slowly they may be resistant to it, but we always evolve, and over time, sooner or later, they're going to become Crockpot families as well. And they'll bitch at first, but at some point, all of a sudden, it's like, I'm a Crockpot family.
Yeah.
I threw all the stuff in the pot, I went out, and when I came home, it's hot and ready.
That's what the SNAP program covered. All right, you
better
ate
than
it.
Little Caesars, hot and ready.
Yeah, there you go.
The new.
It's way better.
And you know what you're getting out of it. Exactly what you put into the pot.
Yeah.
So, I mean, I'm hopeful because it is. It's the kids can't make the smart choices. They really don't understand it. I don't understand why parents these days are letting the kids make the choices. It's nuts. Yeah. And even when, so I do have 2 nephews and I got several nephews and nieces, but they come over to my house and the parents, okay, well, he only will eat the chicken nuggets and this, and I'm like, thank you, have a good day, I'll see you later. And when I cook, I'm making whatever I'm making,
and you're gonna eat it,
and they eat it. And when they come home, we had salmon and we had a corn and bean salad with some roasted sweet potatoes on the side.
They ate it.
And it's like, yes. Because I make the rules at my house.
That's how it worked. That's how it worked.
I love that.
That's how my mom was as well.
So it makes it different. Yeah, it was eat it or get the heck out. Go to your room. And when you're hungry, you'll come out. It'll be here cold, and you're going to eat that.
Yeah.
You got 2
At
problems.
some point, you have to make sure that you're leading them the right way so that when they're older, they know how to make the choices. Because find me a kid who doesn't select the chips, the soda first.
Right.
Unless they've been taught.
Until they've been taught.
I was gonna say my son wouldn't, but
and I will say I do that. I say that, but then I also will be the uncle who's like, "You ate all your food? I got you M&Ms. Come over here. We have our little bag of M&Ms. We shared the bag of M&Ms.
This is the last time you're gonna get them.
It's very different. I was in the store the other day, and a cute little girl was definitely overweight, and she was fighting with her mom in the aisle because she wanted some chips, and her mom's telling her, "You can't have that. You're on a diet." I'm like, the girl's 6. What the hell is she on a diet? I mean, what is going on? And she's treating, and the girl, I want these. What if I don't want to be on a diet? And I'm looking at the mom like, you do understand. You're in control. You say no, and you introduce the proper something that they can eat that might also be favorable.
That's the exact thing. I say my 10-year-old doesn't eat those things, but guess what? We weren't those people who said, you can't eat anything. You can't do anything. And so it's like, you want M&Ms? Let's find a dye-free, better version of that.
You can find options as well.
Let's do homemade cookies that I can control and sweeten with maple syrup. Let's do maple sugar, and then let's do, you know what I mean? So it's not like you have to be like.
Yeah, or you can do like, for example, cigars. Obviously, I'll do a cigar every so often. In Mexico, when you get a cigar, it has a big picture of a mouth with cancer. Literally. So at least you kind of like think about it twice. In the States, you can get cigars and they don't have that picture. But even if you get like a Coke product, yeah, you can get it, but just put a very fat kid. Like super ugly. So the kids, when they look at it, they refrain from buying it. So I don't want to be that kid.
No, serious. And when it boils into, once again, the SNAP program, the whole idea for that SNAP programming and making sure the kids have food in the first place, ultimately, sugar is a luxury. Soda is a luxury. You don't have to have it. It's not necessary in life. It sucks that that's kind of like how you have to think about it, but it is. And so if you require some assistance with getting the food, yes, let's please help those people get vegetables.
Something has nutritional value.
Nutrition. But if I'm working hard so you can have Oreos, but I maybe am not having Oreos right now because I can't in my budget.
Yeah.
That's
you ain't getting Oreos. Yeah, I agree. I'm all in for this change of the SNAP program. I'll support it all the way.